guys, so welcome to the third step of the nursing process. This is going to be the planning step, okay, or the outcome identification and planning. In this step of the nursing process, we're going to establish priorities. So you only have a set amount of time with your patient when they're in the facility. Might be a 12-hour shift, might be an 8-hour shift, might be even less, or it might be just an office visit that you're seeing this patient. So we need to really focus on establishing priorities. What can we work on that's most important, not only to the patient, but to the health of the patient as well? Next, we're going to identify and write expected patient outcomes. Patient outcomes and goals, a lot of times those are used interchangeably. So we're going to write goals for the patient related to um, their nursing diagnosis. So remember, I said everything builds on each other. So we first assess, then we diagnose. Now we're going to plan to help them meet goals related to helping them resolve the nursing diagnosis that we've given for them. We're going to select evidence-based nursing interventions, and I'll show you guys where to find some of those in the book, and we're going to communicate the plan of care. So a good practice is to communicate that with not only the nursing personnel or healthcare professionals, but also with the patient and the family. So when you go in the room, the first thing you might do with the patient is talk to them about their plan of care. Oftentimes we're writing those goals up on the whiteboard that's in the room, and we're talking about the goals that we'd like the patient to work on for that day. Once they meet those goals, then we might either change them, add new ones, or modify them in a way that might help them meet them even more. So what does a plan of care allow us to do? We need to individualize care that maximizes outcome achievement. Each patient should have an individualized plan of care. Even though patients might have the same diagnosis, they might have different responses to that diagnosis. So two patients may be diagnosed with the same type of cancer, but they might have different needs and individualized care that's required for each of them to meet their goals. We want to set priorities, which we've talked about a little bit, and I'll talk to you guys about that a little bit more further down in the presentation. We want to facilitate communication among nursing staff colleagues, promote continuity of care. So I think it's really important to remember that patients respect and really appreciate continuity of care. So if you're able to go into the room and talk to them about the goals that they've met, the nursing diagnoses that they have, what they're working on for that day, and really let them know that you know what's going on with their care, they won't feel like they're just another person or a number. They'll actually feel like they're part of the nursing care, and they'll really feel as if they're getting that continuity that they need to get better. It helps us to coordinate care. It helps us to evaluate patient responses. So when we set a goal for a patient, it's really important that we can evaluate if they've met that goal in order to either make new goals for them, modify the goals, make changes to the plan of care. It helps us to create a record used for different things, and it helps promote nurses' professional development. There's three elements of comprehensive planning. The initial type is that's developed by the nurse who performs the nursing, history, and physical assessment. An easy way to remember the initial care plan is to just think about the nurse who's admitting the patient for the first time. When they come to the unit, you're going to do a health history, and a physical assessment, and you're going to then determine problems that the patient has right then and there. You're then going to initiate the initial care plan for that patient. It addresses each problem listed in the prioritized nursing diagnoses. So remember, we're going to prioritize those nursing diagnoses, and we're going to work on each of those. We're going to identify appropriate patient goals and related nursing care. And like I said, I'm going to show you guys how to do that, where you can find that in the book, in just a few minutes. Ongoing, if you think about the word itself, the word ongoing, it might clue you into what's going to happen in that type of planning. That's carried out by any nurse who interacts with the patient. So the initial is developed by the nurse who admits the patient, who does the history and physical. The ongoing is carried out by then any nurse who interacts with the patient after that. Keeps the plan up to date, manages risk factors, promotes function, states nursing diagnoses more clearly. So maybe we need to modify nursing diagnoses, make them more clear. We develop new ones potentially if the other ones are no longer an issue for that patient. make outcomes more realistic and develop new outcomes as needed. So sometimes we write goals or outcomes for our patient. They meet those. We can modify them because they've met them, or we have to make them more realistic. So maybe we write that the patient's going to walk to the nurse's station and back today, but in reality, that's not very realistic for the patient because they just had surgery. So we then back it down and say the patient will sit up in a chair by the bed by today. So we might have to make them a little more realistic if it's not something that the patient can do. We're going to identify nursing interventions to accomplish patient goals as well. And those are all found in the nursing handbook, diagnosis handbook. You can identify interventions that are going to help meet the goals that you've set for the patient. And then finally, we have our discharge planning. When you hear discharge planning, you might think, that's done right when they're ready to go home. But when you think about discharge planning, the best time that you want to be doing discharge planning is actually right when the patient's admitted. So the admitting nurse is already thinking about what we have to do to get this patient actually out of here and home. Nobody wants to be in the hospital. We want to get them out of there as soon as we can because they're actually at risk by being in the hospital for contracting other types of infections. It's carried out by the nurse who worked most closely with the patient, oftentimes even the nurse who's working last with the patient. Begins when the patient is admitted for treatment, and we're going to focus on teaching and counseling skills. For a patient to go home, we need to know that we've given them everything they need to be, competent at home and to be able to meet the goals that you've set for them and to remain at home. We don't want them to be readmitted because they didn't know they had to do something or they didn't know how to take their medication properly or change their dressing. We also want to set them up with any consultations that they might need after the fact or when they're at home. Maybe they even need home health to help with dressing changes. We want to make sure that's all in place before the patient is discharged. Let's do a little knowledge check here. Which nursing action would most likely occur during the ongoing planning stage of the comprehensive care plan? So think of the ongoing planning stage, which was the second type of planning that we've talked about. Is it A, the nurse collects new data and uses them to update the plan and resolve health problems? B, the nurse uses teaching and counseling skills to help the patient carry out self-care behaviors at home? C, the nurse who performs the admission nursing history develops a patient care plan? Or D, the nurse consults standardized care plans to identify nursing diagnoses, outcomes, and interventions? All right, if you said A, you are correct. The nurse collects new data and uses them to update the plan and resolve health problems. Okay, so let's look at this picture here. Remember, I'm going to show you guys here. Okay, remember, the first part of the nursing diagnosis, the problem statement, remember, Miss Carla Tompkins was acute pain. Her acute pain, then, what this is saying, is going to suggest the patient goals. So a goal for acute pain, for me, if it were me, would be a reduction in pain. Sorry, that's not a very good arrow. So a decrease in pain. And I'll show you how to write these outcomes. But a goal, in a nutshell, would be a reduction in pain, right? We don't want her to have pain. So that problem statement or acute pain is driving, as you can see this arrow down here, the suggested patient goals or outcomes. The second part of the nursing diagnosis, which is the etiology, was what? Well, for Miss Tompkins, it was that she had a surgical procedure, if you remember that from before. She had the below the knee amputation. Okay? So her below the knee amputation or surgical procedure is going to help to drive the interventions. So, what interventions could you do to help with somebody who's had a surgical procedure, who is now in pain? For me, I know if I had surgery or if I was the patient, I want my medications. We definitely want to monitor or assess her pain and vital signs. Okay? Maybe we want to do some, other things, non pharmacological. We can do repositioning. sometimes repositioning is all they need to help with their pain. Okay, so let's go back. Now that you see this, just so you remember, the pain up here, the pain drives the outcome of decrease in pain, and the etiology or the surgical procedure is going to drive our interventions, which are the medications, the assessing pain and vital signs, and repositioning of our patient. So let's go back to the presentation here. Let's look a little bit onto how we're going to prioritize nursing diagnoses. High priority is going to be the greatest threat to the patient well-being. Medium priority is non-threatening diagnoses. Low priority is diagnoses not specifically related to the current health problem. And if you get to them, you get to them, but typically we're not going to be able to do that with a short hospital stay. How we want to prioritize nursing diagnoses, there's a couple ways. One way is your ABCs, your airway, your breathing, your circulation. If you see an airway problem, that's obviously a great threat to the patient's well-being. Same with breathing and circulation. So if you see those things, you want to definitely think of those as high priority. A non-threatening diagnosis would be something maybe that they have anxiety, or maybe that they have pain. Might not be a non pain might be a medium priority if they're having a respiratory problem included in that. So you got to think about what they're having here. In Miss Tompkins' case, her pain would be a high priority, and her risk for infection might be a medium priority because it's not threatening right now. And then her psychosocial would also be considered maybe a medium, potentially a low priority if we're not able to get to those things, and we might have to provide her consultation after she goes home for those things. Let's look at Maslow's hierarchy of needs. This is another way that you can prioritize. You can see your physiological things such as breathing, food, water, sex, sleep, homeostasis, and excretion. Those are all going to be something that are going to be considered high priority. Okay, so the things in the red down here are going to be your high priority things. Safety is another thing that you might consider more of a medium to high priority. It depends on what it has to do with. So as you move up Maslow's hierarchy of needs, they become less of a priority. Not that they're not important, but they might not be something that you're worried about when the patient's in the hospital. It might be something that they have to you maybe have to send them home with as home health or counseling or support when they get home. So which nursing diagnosis would most likely be considered a high priority? So would it be A, disturbed personal identity, B, impaired gas exchange, C, risk for powerlessness, or D, activity intolerance? If you said B, impaired gas exchange, you're absolutely correct. That's a physiological need that must be met first. If we go back to these, just looking really quick, and we were to put these in order, we might say that impaired gas exchange would be number one, obviously, because that's on Maslow's hierarchy. It's also on ABCs. It's one of the ABCs. And then we might say that activity intolerance would be priority number two, okay? Because by having activity intolerance, that can lead to a lot of complications, such as pressure ulcers, pneumonia, things like that, depending on how intolerant they are. Then we might go to maybe a risk for powerlessness, depending on what the patient is going through. That might be our next priority, or it could be the disturbed personal identity. Both of those are social type nursing diagnoses and might come further down the road. So it really depends on the patient and what their needs are, maybe what their preferences are for those two. But definitely the impaired gas exchange is one, activity tolerance is two. The other two, we could probably argue either way that those could be 3 and 4. Clinical reasoning and establishing priorities. You might ask yourself these questions when you're trying to prioritize. What problem needs immediate attention? Which ones can wait? Okay, so maybe based on Maslow's or ABCs. Which problems are your responsibility and which do you need to refer to someone else? So we might have to consult out for some of those, especially the psychosocial. A lot of times nurses aren't necessarily trained well to deal with psychosocial concerns of the patient, but we definitely can consult out to our case management, our social work, things like that, and they can help with those things. Which problems can be dealt with by using standard plans? Which problems are not covered by protocols or standard plans must be addressed to ensure a safe hospital stay? Have changes in the patient's health status influenced the priority of nursing diagnoses? So maybe they weren't having an airway problem, but now it's developed. So there's a shift now in the prioritization of the nursing diagnoses. Are there relationships among the diagnoses? What that means, so if you could work on one and then it resolves the other one. So just say they have a diagnosis of pain and they also have a diagnosis of activity and tolerance. Maybe by dealing with the pain, the activity and tolerance will go away. Oftentimes, people don't want to move if they're in pain. So we'll say that they're activity intolerant, but if we just deal with their pain, they might be more tolerant to the activity that you're wanting them to do. And can several patient problems be dealt with together? So sometimes we can cluster some of those, and when we help with one, it helps with another. Let's talk about long-term versus short-term outcomes. There's two types of outcomes, as you see here. Long-term require a longer period of time, may be used as discharge goals, and short-term outcomes may be accomplished in a specific period of time. Typically, they say, a week or less would be more of a short-term goal for a patient. So, just to give you an example, go ahead and write here for you. A long-term goal, and we haven't talked about how to really write these, but a short-term goal, let's just say, is less than a week, and a long-term goal is greater than a week, up to discharge. So a discharge goal, something might be that for Miss Carla Tompkins, a short-term goal would be that her pain is reduced, a reduction in pain after med administration. So after each med administration. A discharge goal would be that her pain is decreased in pain to probably, hopefully, maybe a 0 by discharge. So maybe by discharge we'd like her to be a 0 if that's realistic for that patient. So you can see we want to decrease the pain maybe to a 4 out of 10 after pain administration each time, less than a week, and then greater than a week if she's still here. We'd like her pain to be reduced to a 0 or whatever's tolerable for her, 0 or maybe a 1 by discharge. Okay, so you can see that there. And we'll talk about how to write goals. We can't write them until we know how to write them. Categories of outcomes. So there's 3 categories of outcomes. We have cognitive, which describes increase in patients' knowledge or intellectual behaviors. Psychomotor describes patients' achievement of new skills. And I want to emphasize new skills. So psychomotor is patients' achievement of new skills because sometimes students get confused about that if they're just doing a skill, it's psychomotor. A lot of times doing a skill can fall under cognitive if it's a skill they already knew how to do, but if it's a psychomotor type of outcome, it means that they have a new skill. So for Miss Tompkins, an example of a new skill would be using a prosthetic. That would be a psychomotor. Applying her prosthetic and using it appropriately would be a new skill for her. Affective describes changes in patient values, beliefs, and attitudes. I want to give you examples of each of these to make it a little more clear for you guys. Sorry, I like to write a lot on the screen. So cognitive, I'm just going to give you an example of a cognitive and give you a verb that goes along with that. Patient will state. This state is directing you to cognitive. Psychomotor, patient will demonstrate. Demonstrate is psychomotor. And like I said, that would be a new skill. So I'm not finishing the whole outcome statement, but I'm just giving you the word that can then direct you to know what type of outcome it's relating to. Patient will let's think of an effect. Patient will um, patient will describe a change. Hold on, let's go back. Okay, so let's talk about the different categories of outcomes. I'm going to go ahead and write on this for you guys here. So, cognitive describes increases in patients' knowledge or intellectual behaviors. So, a cognitive outcome, and I'm not going to write the whole outcome statement because we're not quite ready to do that yet. Patient will state. This state right here is directing you, let me just erase that little there, to a cognitive outcome. So, patient will state. You're then in the cognitive category of an outcome statement. For psychomotor, patient will demonstrate. So psychomotor, demonstrate is indicating that you're in a psychomotor skill. Now something I want to point out about psychomotor outcome is that it's achievement of a new skill. I can't say that enough. New skill. Why I'm saying that is because oftentimes it's confusing to know if they're in cognitive or psychomotor, but the development of a new skill, such as Miss Tompkins demonstrating how to apply her prosthetic appropriately, would be a new skill for her because she's never had a prosthetic. So that's a new skill for her. Let's look at effective here. Patient will verbalize value valuing something like their health, something like that. So effective is verbalizing maybe a change in the patient's values, beliefs, and attitudes. So patient will verbalize valuing their health more and making this change. So effective are always the hardest, but if you see something that's related to making a change in their values, beliefs, and attitudes, maybe they've decided to stop smoking because they value their health enough, or more now, and want to stop smoking, or maybe they value their health more and they want to make a change in their weight, something like that. So you have to think about if it looks like a change in the values, beliefs, and attitudes, that's going to go along with the effective outcomes. So let's look at this knowledge check here. Which outcome is an effective outcome? Ooh, threw the hardest one at you guys. So let's see. A. By 6, 9, and 15, the patient will correctly demonstrate the procedure for washing her newborn baby. B. By 6, 9, 15, the patient will list 3 benefits of eating a healthy diet. C. By 6, 9, 15, the patient will use a walker to ambulate the hallway. Or D. By 6, 9, 15, the patient will verbalize valuing his health enough to stop smoking. All right, if you said D, the patient will verbalize valuing his health enough to stop smoking, you are absolutely correct. So let's look back at this question really quick. Number 1, where the patient will correctly demonstrate the procedure for washing her newborn baby, that would be a psychomotor. That's a new skill for this person washing a newborn baby, so that would be psychomotor. B, the patient will list 3 benefits of eating a healthy diet. That would be cognitive. They've learned something. They're able to state 3 benefits or list 3 benefits. C, the patient will use a walker to ambulate in the hallway. That could be a psychomotor. If it's a new skill for the patient, using a walker, then that would be psychomotor. And then we said, D was effective. So very good, guys. Alrighty, so we finally made it to the parts of a measurable outcome. I know you guys have been waiting a long time for this. I keep saying we don't know how to write an outcome, and we finally made it to that point. So let's talk about what you need in an outcome, and then we'll write a few together. Parts of a measurable outcome are going to be a subject, verb, conditions, performance criteria, and target time. Now, I will tell you that the Conditions aren't always included in an outcome statement. And I'll give you an example of where you can use it and where you don't need to use it. Sometimes you'll see them with it, sometimes you'll see it without the conditions. So remember the parts: subject, verb, conditions, performance criteria, and target time. Remember that your goals need to be specific, measurable, attainable, realistic, and time bound. So make sure your outcomes are SMART. It's an easy way to remember it. Specific, we don't want vague outcomes. Measurable, we want to make sure they're measurable, that we can actually figure out how to meet them. They're attainable, so you're not writing goals that are just non realistic for your patient and they're never going to attain them. Realistic, that kind of goes along with that. And time bound, so each goal has to have a time frame. So let's write a few together. Oops, let me go back over here so you guys can see the whole thing. All right, so let's write, and you can tell me if I have all the parts. Let's write an outcome together. So let's think of Miss Carla Tompkins. Her diagnosis was acute pain, her nursing diagnosis. Okay, now we're down, and her assessment was done earlier, and that's how we came up with the nursing diagnosis of acute pain. Now, we're in the P of the ADPI. Okay, we're planning for her. We're going to write an outcome statement. So, an outcome statement is going to be a subject. Who's our subject? Well, subject's the patient. So, patient will. What goal goes along with acute pain? We talked about it a few slides ago. Remember, it was a reduction in pain. So, patient will have a reduction in pain from 7 out of 10 to a 4 out of 10 after pain medication administration. Okay? Or if you want to make it more time bound, you can say by a time. So patient will have a reduction in pain from 7 out of 10 to 4 out of 10 by X time. Okay, date and time. So let's see if we have all the parts here. Okay, the subject is the patient. The verb is have. This one does not have a condition. Performance criteria is a reduction in pain. And the target time is either after pain administration or by whenever. Okay? A condition might be something like patient will walk to nurse's station and back unassisted or assisted. So the unassisted or assisted would be your condition. The pain, I don't know if we could write one for her that would have a condition, but it might say if you're not using pain medication, may say patient will have a reduction in pain from 7 out of 10 to 4 out of 10 um, with or without pain medication might be the condition. So it just depends on how you're writing these. But for now, we'll just keep it without a condition. Like I said, a condition isn't always necessary, so we don't need the condition there. We want to make sure that this is a SMART outcome. Is it specific? Yes, because we have from 7 out of 10 to 4 out of 10. Is it measurable? Yes, because we have 7 out of 10 to 4 out of 10. Is it attainable? I think so. Is it realistic? Sure, because we think that she can go from a 7 to a 4 easily. And it's time bound because we have a time frame there. All right, so good job writing an outcome. We can write another outcome if you want to do it for her. Actually, we're going to do it on the worksheet after. So let's just go ahead and move on for now, for time's sake. Some common errors that you might see in writing outcomes: expressing the patient outcome as a nursing intervention. So remember, we always want to keep it patient focused. Patient will, not nursing will, because that would be nursing related. Using verbs that are not observable. So an example of that would be saying something like patient will understand. It's hard to measure understanding without actually having the patient do something like state or verbalize or perform or demonstrate. including more than one patient behavior or manifestation in short term goals. So sometimes I've seen where there'll be more than one goal. So patient will have a reduction in pain, patient will eat half of their lunch, patient will um, maybe void 2 times by this time. So they're adding a lot of different outcomes within a short term outcome. And then writing vague outcomes. So a vague outcome would be something like patient will have a reduction in pain. Well, your reduction in pain is different than my reduction in pain, and we might not be thinking the same. So you really need to be a little bit more specific and not write them so vague, or it's not easy to determine if they've been met or not. So let's do a quick knowledge check here. Patient is suffering from shortness of breath. The correct goal statement would be written as: the patient will be comfortable by the morning. The patient will breathe unlabored at 14 to 18 breaths per minute by the end of the shift. The patient will not complain of breathing problems within the next 8 hours, or the patient will have a respiratory rate of 14 or 18 breaths per minute. So if you think about this, before you answer, think about if it has all the parts. Remember, we need our subject, which is the patient, our verb, we need our possible conditions if we have one, we need our performance criteria, we need our time frame. So which one of those has all of those things? Well, if you answered B, you're correct. It contains a subject, a verb, performance criteria, condition, and a time frame. And actually, I think this one has all of it. So let's look. The patient is the subject. Will breathe, verb. Unlabored is actually the condition. At 14 to 18 breaths per minute is your performance criteria. By the end of shift is your time frame. So we have everything there. Good job if you answered B. All right. So types of nursing interventions. So we talked about the outcomes. Now we have to talk about how we intervene. So we've written the goals for Miss Carla Tompkins. Now we have to talk about how are we going to intervene with her? How are we going to provide interventions that help her meet her goal of reduction in pain? So there's different types of interventions. You're either going to have nurse initiated or physician initiated or collaborative. Nurse initiated are performed by the nurse without a physician's order. Physician initiated are actions indicated by a physician in response to a medical diagnosis but carried out by a nurse under the doctor's orders. And collaborative are treatments initiated by other providers and carried out by the nurse. So, for example, a nurse initiated would be that maybe we provide Carla Tompkins with some pain reduction by repositioning her or providing some distraction or some non pharmacological methods of pain reduction. The physician initiated would be that they've ordered the pain medication. We're going to go ahead and give those prescribed medications and administer those to the patient. And collaborative would be treatments initiated by other providers, carried out by the nurse, maybe PT, OT, and ST. Okay. We could also provide range of motion, and that would be in collaboration with our PT physical therapists. So example of nursing interventions, we might offer the patient 60 milliliters of water or juice every 2 hours while awake for a total minimum PO intake of 500 milliliters. Or maybe teach the patient the necessity of carefully monitoring fluid intake and output, remind patient each shift to mark off fluid intake on record at bedside. So those are just some examples. In relation to Miss Tompkins, we might do things like we talked about, provide some repositioning, maybe assess her vital signs, assess her pain using the pain scale. We also would administer pain medications and educate her on when to um, when to ask for pain medication and the side effects and all that stuff that goes along. So those are some examples of nursing interventions related to Miss Tompkins specifically. So a little knowledge check here. A collaborative intervention is an intervention initiated by a physician in response to a medical diagnosis but carried out by a nurse in response to a physician's order. True or false? It's actually false. This would be a physician initiated. Remember that physician initiated is initiated by a physician in response to a medical diagnosis but carried out by the nurse under doctor's orders. And we gave the example of the pain medication prescription. NANDA, we talked about NANDA a little bit in the nursing diagnosis, but just so you guys know, there's something called NIC and NOC. I'm actually never going to test you on this. It's kind of nice to know information, but what I want you guys to know that there are classifications that NANDA uses to identify nursing interventions and outcomes, and they're very broad statements. So, for instance, for Miss Tompkins, a nursing outcome classification or NOC might be something like pain reduction. So, the pain reduction or maybe comfort would be the outcome classification, and then there's going to be different things under that that helps you meet that outcome. And then there's classifications of interventions as well. This is very nice to know information. You do not need to worry about studying this. Just wanted you to know if you ever heard somebody yell out nick and knock, you would know what they were talking about. So, based on based on the nursing diagnoses for Mrs. Carla Tompkins, what would be a short-term and long-term goal? So at this point, let's go ahead and oops, let's go ahead and go to our care plan again. So you guys remember this? We wrote these nursing diagnoses out for Miss Tompkins. We have her acute pain related to surgical procedure as evidenced by the patient stating 7 out of 10 pain and patient grimacing with movement. Let's write a short-term goal for her now, remembering all the things we need to have. So remember, guys, we have to have a subject, a verb, possibly a condition, performance criteria, and a time frame. Okay, so let's look at what we can do for Miss Tompkins. And actually, before we write this short-term goal, let's actually go over, and I hope I'm still signed in here. Yeah, here, good. Okay, remember the nursing diagnosis handbook? We had acute pain here. Look at the goal that they've suggested. The patient will verbalize or demonstrate relief of pain. Okay, so that's honestly just an outcome, a very broad outcome, but we want to write one that's a little more specific for her. And then here are some interventions that go along. Maybe we administer medications to reduce pain, monitor vital signs, respiratory status, allow alternative pain treatments that are culturally relevant. We might assess the patient's pain. We kind of talked about that before. Assess the patient's pain using appropriate pain assessment tool. Assist the patient into a comfortable position. So we talked about repositioning. There's a lot here that we can do. Here's our distraction right here, such as watching TV. Encourage the patient to take medications early on to prevent instances of severe pain. So all of these guys we can use to help with Miss Tompkins. I think a lot of these would work for her. So let's go ahead and go back to our plan of care here. So let's write a short-term goal for her. So a short-term goal, remember we're always going to start with patient will. What do we want to do? We want to reduce her pain, right? So patient will verbalize, state, whatever we want to say, state a decrease in pain from a 4 to 10 after pain medication administration. Or like I told you guys, you can put a time frame there if you have it. Remember, a long-term goal for her might be that the patient will be free of pain by discharge. Okay, so we just wrote short-term goals for that one. Let's make sure we have everything. Did we have a subject? Yep, we had our patient. Did we have a verb? We had state. Did we have a condition? We don't have a condition for this one. Like I said, we don't always need a condition. Do we have a performance criteria? Yep, we're going to reduce our pain to 4 to 10. Do we have a time frame? We said after administration, or for this one we said by DC. So each of them have all of the things that we have up here. And I like to make sure I have all of the components, and I think that's a good practice for you guys. Let's go to our risk for infection. Okay, so what would be a good short-term goal for our risk for infection? What do you guys think? Maybe patient will. And you don't always need, what I will say is you don't always need a short-term and a long-term goal, um, but patient will be free of signs and symptoms of infection by um, end of shift. We'll just say end of shift. Now, if you wanted to do this long term, you can just say patient will be free of infection by discharge. Or some students will write throughout stay. That's fine as well. Okay, so we wrote two really good outcome statements. Let's just check ourselves. Do we have a subject? Yep. Do we have verb? Yep. Do we have performance criteria? Yep. And we have a time frame right there. Perfect. Oh, guys. Very good. Okay, let's go back up here. Whoop. Got to make that a little smaller. Gosh, we're almost done with our concept map. How exciting. Okay, so list a minimum of 3 interventions. So a little trick that I do, guys, that I think helps students is, oh goodness, sorry, my writing's getting worse and worse. Assess, teach, do. I think what's nice about a interventions is having an assessment intervention, a teach intervention, and a do or an action type intervention. So if we go back to our book here, administer medications to reduce pain. Perfect. That's going to be my do. I like that one. Administer pain medications. Perfect. What could we assess? Actually, look, assess the patient's pain as ordered. Perfect. I like that one. So we're going to assess patient's pain using the appropriate pain scale. And what can we teach the patient about without looking at the book? What do we think? What about teaching them about their pain medication? So educate, oh my goodness, sorry, patient on pain medication. Perfect. By educating the patient on their pain medication, they actually might be more likely to take it. And if you actually educate them on when to take pain medication, before it gets really severe, because it's easier to treat when it's not as severe, they'll have a more effective outcome. Okay, so those 3 interventions are going to help Miss Thompson meet her goal of decreasing her pain. Because by assessing her pain, by teaching her about pain and pain medication and administering pain medications, we're pretty sure that's going to help her meet her goal. Let's look at some interventions for keeping her free of infection. So what can we assess? What can we teach her? What can we do for her? Okay, so what can we assess for infection? Well, assess wound, okay, and we can actually even add for signs and symptoms of infection. What can we teach her? We can teach about signs and symptoms of infection. By educating her about those, we might catch it earlier if she actually ends up developing one, like an increase in pain, increase in swelling, redness, things like that. What can we do for her? Well, we're going to complete dressing changes per order. So those 3 things should help Miss Tompkins meet her goal of patient will be free of signs and symptoms of infection by end of shift. Very good. All right, guys, so very good job writing your short term and long term goals for Mrs. Tompkins. After this, we're going to move on to the implementation phase or step of the nursing process.